cancer awareness conversation, which comes up second and fourth Wednesday of every month. And this time we'll be looking at what chemotherapy is all about. Dr. Dennis Edger will be taking us through that narrative, and she's joining us virtually. I'm sure she's already sitting by. Good morning, Dr. Dennis.
Good morning.
Over to
you. Good morning, viewers. Welcome back to another edition of Kakaki Cancer Awareness with Denise Edjo, the CEO of Comwood Cancer Foundation, in partnership with the AIT. Together we fight, together we win. Thank you all for joining us again. What are we talking about today? We're talking about chemotherapy. What is chemotherapy? What is it all about? And I would say to you, one of the reasons why this conversation has had to come up was when I started to find out that people, not just in Nigeria, but across the world, really had a very wrong misconception of what chemotherapy is. So, chemotherapy is a cancer treatment where medicine is used to kill cancer cells. That is the layman English of what chemotherapy is, from what I understand. But we've got a specialist in our house. We've got today Dr. B, as I like to call him, but I have to call him his full name today, Dr. B. Olutunde Olusegun. Doc, how are you?
Hi, Dennis. Good morning. I'm really good. Thank you for having me on your beautiful program.
Thank you for joining. Thank you for your time. How are you doing? So let's look at it. Today we are going to have a candid conversation on chemotherapy, especially as we're focusing on facts to reduce false information and myths. As you all remember, together we fight, together we win. Let's start this conversation. So those of you who are...
Right, let's go.
Let's go. Let's start this conversation.
Yes.
All of you watching online, come on then. Share, subscribe, let people know that we're online now. So who's our guest today? I'm going to talk about him. I always have to tell you who they are so that you know. Dr. V is a consultant and fellow of the West African College of Surgeons. He specialized in medical and radiation oncology that determines best evidence-based clinical practices. With the combination as well as sequence of systemic therapy to include chemotherapy, targeted therapy, hormonal therapy, and radiation, to name a few therapy, his aim is to ensure treatments are individualized to patients requiring oncology treatment. He's also active in research and very keen on collaboration that helps increase knowledge in the ever-evolving cancer field of clinical oncology. He also advises on the Comwood Cancer Foundation Advisory Board, supporting our campaigns globally. Good morning, Doc, and how are you? Now I'm ready for you. Now I can go. Thank you for joining us.
I'm really great. Thank you. Yes. Let's do this.
Now you know I was looking for something from you yesterday.
Yes, now I know.
Now you get it. Okay, so let's go. What is our questions now? One of the reasons we're all laughing about this, but like I always say, I live with cancer and I take chemotherapy, and I have taken chemotherapy for over 7 years. So that's why this conversation is very important to me. So Doc, can you help us all? What is chemotherapy?
Okay, fantastic. Dennis, you know you're an inspiration all the time. And I think it's fabulous what we're doing here today, because one of the biggest issues with cancer care is this morbid fear of chemotherapy that a lot of people have that makes them, unfortunately, avoid treatment until sometimes it's far too late. So I think it's excellent that we're having this discussion this morning, and I'm really hoping it's going to help a lot of people come to terms with and understand what the benefits of this treatment is. So chemotherapy in itself, like you said, is basically, very simply put, the use of drugs to kill cancer, to destroy cancer cells, to try and help anyone who is living with cancer to overcome the disease. Now, to just highlight a little bit, you have to understand that there are two things that make cancer really very difficult. One is its tenacious nature, stubbornness, always wanting to come back, or refusing to go. And then the second part of it is that cancer can leave where it started from and spread to other places. And therefore, chemotherapy is a very, very, very useful, helpful instrument in the hands of physicians to actually try and help patients overcome the stubborn nature of this illness by administering a medical treatment that they put in the veins or in the bloodstream that then goes all over the body and directly begins to attack these cancer cells and kills them to give the patient an opportunity or at least a chance to beat the illness. And it will interest you to know that it's been around for decades. I mean, it was, I think the history of chemotherapy goes back to the Second World War when some biochemical warfare things like nitrogen mustard were found to actually reduce the number of white blood cells and things like that in the blood. And then people got thinking and said, oh, if this can happen to normal rapidly dividing cells, which is the hallmark of what cancer is anyways, rapidly dividing, unstoppable growth, then perhaps we can find a way to channel this. So years and years and years of research have gone into what chemotherapy is for us to get to a point where we can now safely use it to treat cancer patients. Dennis.
Thank you. You know, it's very interesting the way you've taken it, because it was, and I say this with also, it was a big shock when I went out with a few people in the UK, not in Nigeria. And they said to me, what is this chemotherapy? How many days do you spend in the hospital? Are you on admission for a long time? Do you have to stay? And I was like, because the way you talk about it, and I thought, wow. I said, is that what you understand it to be? He said, yes. First one said yes. I was like, and this is in the UK. So if in the UK the notions are already wrong, how much more the notions?
How much more? Yeah, yes.
And so it became and it's something that just made me realize, no, let's talk about this conversation. And then you've now answered something that was important. How is it administered? Which was the options through the veins, through tablets, through what's it? Intravenous?
Yes. So there are several ways that chemotherapy can be administered, but what you're aiming is for it to get to that area where the cancer is. So it can be given through the vein, like I mentioned earlier. There are some that are in tablet forms. You can try to get chemotherapy directly into the tumor in itself, and sometimes we do something interperitoneal, which means like if somebody has a tumor in the abdomen, for instance, you can just inject some into the abdominal space so that the tumor is based in the chemotherapy. And even we have sometimes chemotherapy as creams that can be administered for maybe like skin cancers and all of that, So there are several ways it can be administered. But I think maybe the commonest and the biggest is through the vein, through an IV access that has been gotten for the chemotherapy to then be able to get into the system and go all over the body.
Wow. Thank you, because that is very key, and that was very important to understand. I think, how do I take? I have taken tablets. I take tablets. I take infusion, and I take one in my leg every 3 weeks. Intramuscular, I don't know.
Under the skin or intramuscular. Yeah. And look at you. Here you are, the perfect poster child for helping people understand that chemotherapy is not that terrible thing that they, I don't know how, but inevitably believe that it is, because on a day-to-day basis, what you have to deal with as an oncologist in the clinic to get people to accept that this is not the dreadful thing they've heard or that they think it is, it's a lot. But I think you're the perfect poster child. 7 years on treatments, constant steady treatment, and looking good for it. Glory to God for that.
Thank you. We thank God for it. You're right. God is centered to it.
Yes.
So my next question. King Charles
Yes.
of the UK opted for alternative treatment, while his Princess Kate is undergoing chemotherapy. The reason I'm bringing this thing is that a lot of people have a way of referring to people we don't know on chemotherapy. And then when the famous people speak, we were very quick to say, well, this person is not taking chemotherapy, so I don't need to. And that's why I used one family. One is 70 years, over 70, opting for alternative medicine.
Alternative.
And another one who is young and has children opting for chemotherapy. I want you to weigh in on this conversation because when I started this thing, I wasn't 50. And nobody could convince me for this alternative because I have children to look after, which makes me understand where Princess Kate is coming from. However, I'm passing it on to you. Where in the common risk factors associated with chemotherapy that makes people just not want to do it? Because whatever the risks are, I am, like you say, a poster child. I'm not a poster child, whatever. I believe that sometimes we have to wait.
You're living the life itself, yeah.
Okay, we have to wait. So I give it to you now.
All right, thank you. It's really interesting and a very useful example that you brought in. I mean, like, here's the first thing we need to understand, that patient preference is something that is very big in medical care. What the patient wants is what the doctor, your job as a physician, for instance, when a patient is with you, is to lay out all the options, treatment options that are available, and then allow the patient decide on what is best for them. So everybody has the right to make a choice. But in determining what you're going to give to a patient, there are so many factors that come into play. One is the stage at which the disease was diagnosed. Now, if a disease was diagnosed very early and there's a good chance of getting rid of it completely from the body, you want to throw everything at it, including the kitchen sink, to give that patient a really good chance of beating the illness. Remember what I said earlier about two hallmark things: stubbornness and the capacity to spread. Stubbornness, refusing to go or always wanting to come back, that's the cancer itself, or the ability to leave where it started from and spread to another place called metastasis. So if a disease is diagnosed early without it having spread, or at least the spread is not visible, you're thinking about, we need to go. You know, that's one thing that is going to decide what treatment options you offer a patient. Another one is what is the age of the patient? I mean, younger patients who have a long life expectancy, who naturally would have a longer life expectancy, you want to give them the best chance of living their full life. If someone is in his 70s and says, "Oh, I'll rather not go through some rather difficult treatment," you must remember that the older you are, the more you also have some comorbidities. Comorbidities meaning other illnesses that may be present in your life at that time, like high blood pressure, diabetes, things that could complicate aggressive treatment with chemotherapy, you know, or make it a little bit more dicey. That's there. So a patient may not even be fit to have that level of treatment in the first place. So all these factors come to bear in you deciding what the patient is going to take in terms of treatment. And therefore, if King Charles says, "Oh, I'm in my 70s, I mean, I've lived a good life, I'd rather not have," we also don't know if he's dealing with other comorbidities. We don't know what the challenge with his heart is, if maybe there are some really big contraindications, because you can't give chemo to everyone. It's something that you have to individualize treatment. One of the things you said about me when I was passionate about individualizing treatment, meaning that you tailor the treatment to suit the patient. And finally, the patient always has a choice to make. Like I always tell people, you can't decide what you want. It's just that the consequences of these decisions also belong to you. So if your doctor thinks you need to have chemotherapy and then you say, "Oh, I'm scared," or "I don't want," or this or that, "I've heard this about it," you may then not take, but further down the line, you may have to deal with the consequences of the choices you made earlier. And so to answer the second part of the question you asked me, which is what are the challenges associated with chemotherapy that gives it such a bad name? The truth of the matter is that people need to understand that cancer is primarily a disease of the body in itself. So it is your cells. For instance, if we're talking about breast cancer, it is a breast cell in the body that has become abnormal and started growing abnormally fast and constantly, and it will not stop. And therefore, because this is a disease of the body primarily, then if you recast your mind back, there was a time when the treatment for malaria was chloroquine. And people will take chloroquine to treat malaria, but suffer about 3 or 4 days of itching. Can be so severe. I remember that I used to be so afraid of telling my mom I wasn't feeling well that I would hide the malaria for as long as I could until she herself found out, just because of that beastly side effect of the itching. And so this is a disease that is coming from outside the body. A parasite was introduced into the body, and then the treatment is still causing such adverse reactions. Not to talk of a disease that is a part of the body behaving abnormally. So anytime you treat it, it's inevitable that there's going to be affectation of other cells of the body, right? And so when people take chemotherapy, particularly things that are growing fast in their body tends to be affected more by the medication they just took. And that's why the hair falls off, because it's constantly and rapidly growing. That's why they have nausea and vomiting, or maybe even diarrhea, because the natural lining of the intestine is something that is always being replenished. The rate of growth there is very fast, because of the friction and all the attending digestive process. So through that, so there's a tendency to affect it, and then that would give you nausea or diarrhea and things like that. People suffer from blackening of their palms and of their nail beds and so on and so forth. They may have a feeling of unwellness because a chemical component that is foreign to the body has been introduced into them. But I must rapidly mention here that despite this side effects, chemotherapy is still a very useful, powerful tool in helping patients who have had cancer. You have to remember that magnifying the fear of the disease more than the fear of the treatment is the way to go. When you magnify the fear of the treatment more than the fear of the underlying disease, you tend to make a lot of mistakes, because the deception of cancer is that in that time when you can take good treatment and get rid of it, it's really not looking like it's that serious. Why? I'm not feeling pain. I can move from point A to point B. Why am I going to need to take this, that they've said this? But it's the deception of cancer, because in those early days when you can actually get rid of it, it's quiet sense. It's just making you feel like it's not such a big deal. It's if someone had appendicitis and came to the hospital, the excruciating pain, once they tell you, oh, I'm going to operate you, you are going to agree because there's pain. But cancer tends to mask a lot and hide, for a long time before it starts to bring some sinister signs that would make you. And at that point, it's usually late. So people find it difficult understanding why they have to go through this unpleasantness when what they are going through doesn't seem to be so severe, right? So these are the issues, and these are the things that we always have to talk to people about. So making your choice as per what you want, speaking with your doctor to determine what is right for you. Are you even fit for chemotherapy? Is the disease such that, someone can decide, I don't want to take treatment. If I die, I die, and that's fine. That's a valid choice for that individual to make, because he has come to terms with it. And let me just quickly add now that when side effects that I've listed that commonly happen with chemotherapy are for a short period of time and are often mild. In my experience, more than 85% of patients are able to function on a day-to-day basis despite the marketplace noise of how bad chemotherapy is. People can go to work. The side effects are oftentimes not as bad as people taught them to be. When you read about them on social media, when you see people who have had bad experiences about cancer, and then you're hearing what they're saying about chemotherapy. But I'm going to let you jump in now because this is something I'm really passionate about, and I can just keep going on and on and on.
No,
So let
but
me.
it was, yeah, but what you're saying is true because, like I say, I am in it, and everybody says, "Oh, you look good," but I still took chemo this morning. So yes, you are right. A lot of people have a lot of wrong or misconceptions. Some chemos
Absolutely.
affect you initially for a few days, sometimes up to a week, but after that, life goes on because the body starts to repair. So you take you have diarrhea. Yes, most people that take chemotherapy will have diarrhea, but you have medicine. You take diarrhea for the few days and it will stop. You have whatever it is, whatever the side effects are, there's always a simple solution. And to be honest with you, I've even used Gary to stop the diarrhea. So please, yes, I drank Gary, and instead of I did a salt and sugar. What do you call that thing? That thing that we drink.
ORS.
Yeah, that's what I used. So because I didn't want to end up in hospital. And sometimes we know our body. You're right, we know our body. Now there's one thing I want to ask about. Religion becomes a center of this whole cancer journey. And because I've been on it, this is 8 years in August.
Yeah.
And funnily enough, I'm looking forward to what life holds for me. I'm not going to lie for it to you. There's nothing, I'm actually looking forward to it. So, religion has hindered engagement in chemotherapy. We have to be factual. And it's always I have always personally wondered why, because God is still God and all our days are numbered. So how do we get the positive impact shared in these religious centers to reduce death rates and create more advocacy and awareness? Do you get where I'm coming from? Because if they help us,
it's actually a big issue.
Yeah, go on.
Can I go ahead?
Yeah.
Oh, okay. Sitting in the clinic on a day-to-day basis and being a deeply Bible-believing person myself, you deal with these issues on a day-to-day basis. When someone comes in and says, "This is not my portion," this should not be happening to me. I always tell patients that, first of all, I have profound respect for your faith. And I'm not here to ridicule whatever you believe, but I think you've come to me because I have knowledge in this field that you would benefit from, so that you can then make up your mind. My personal conviction is that religion tends to tie a lot of people's hands because either they misunderstand or healing has been misrepresented to them. As a doctor, I've treated pastors' wives, I've treated pastors' children, pastors' parents, and I've treated people who are really deeply, deeply religious, faith-filled people. Whatever their religion is, they truly believe. But the truth of the matter is that I think where we're getting it wrong is, for instance, to think that a healing that comes from going to a hospital to get treatment is inferior to the abracadabra. I was supposed to do this. I said the prayer, everything disappeared, and I'm better. I think that's where we're missing it. Because then we've evolved so much now that we're at a time in life, in the wonderful advancement called science, where a mother can be pregnant with a child and we will detect that there is something wrong with that child. And before delivery, you put the mother to sleep, you open up her womb, operate on the child to correct whatever that deformity is, close the woman up, and then she wakes up and carries her pregnancy to term, and then delivers a normal child. Saves her a lot of horrors that she would have experienced. This is where we are today, where God has allowed us to be by increase of knowledge. And it's the same increase in knowledge that led to, in my opinion, creation of airplanes, economic policies that can correct something abnormal, just an outpouring of knowledge. And I think that, unfortunately, like I have a sister whose pastor's wife had cancer in the UK, and the whole church knew. But a lot of times over here, people just hide it. You are not supposed to be sick, and so on and so forth, and which is absolute crap. Because as far as I'm concerned, God created these ways of escape, including this chemotherapy we're talking about, to help his children actually beat an illness, And so I think it's about time that religious and cultural and social leaders, including pastors and imams, tend to help people to understand how they can actually embrace this treatment and not feel guilty, like they are not being faith-filled or being representing God the way he wants, because it's a really, really, really big issue. And chemotherapy, I think, is an instrument that God himself gave us. If you follow how we developed it to where we are today, with an array of medications that help and even cure. Because, as far back as in the 60s, we found out that using chemotherapy can cure some cancers like lymphomas and so on and so forth. So we're at that point where cancer can be cured with this treatment. How is that not an act of a loving God helping his children out of a big issue that is always so concerning? So there you go. I think it's time that they embraced all of that, and I shared a lot of my own personal opinion, which is how I see it, and I'm hoping that it would help people to come to terms with and understand that they are not betraying their faith when they step up to take treatment, that it was even God himself that made us have it in the first place.
Thank you, because I actually am very strong in a lot of the views that you have shared. And I think most people who really understand faith and sat back to think about faith would understand that God hasn't left them in this journey. And actually, one of my biggest prayers, and I pray with a lot of people, I always tell people who are close to me, is I always turn and say, what has God said to you? And actually follow his instructions. He will bring you the right doctors, the right team, give you the support network that you need to navigate this journey, which is why I always smile, even in the midst of the pain. Okay, let's go on to another one. So I think I'm going to finish here, but it's not a very short one either. So as we're about to finish this program, I want you to give me 3 strategies that we can benefit from going forward. But today, I'm not thinking about financial, as you can imagine. We're talking now about the chemotherapy itself. I want to focus on it because that has been a big thing. We always talk about, well, it's expensive, is this? No, that's not what I want to talk about. Let's talk about the human person taking this drug. So today is not thinking about the financial. So what can we do, or what can government do to ease access? Now, let me start with one of the things that came to my mind. And one of them was complementary therapy. Funding complementary therapy. It's important, because even I'm going for one today. It's important because sometimes it's batter, and then you have an opportunity to either sit down with friends, sit down in groups and just chat, whatever, I don't know. But what can the government do to help? That's my own. Using or creating cancer centers, either complementary centers, not cancer centers, complementary centers. I want you to give me your views on that part for the government. I want you to give me a view on something that the private sector, and then the last one would be for the NGOs and
individuals and NGOs.
And okay, me on that one. Those are my key last 3 questions.
Yes. But before I quickly address that, let me just quickly say again, and I think we need to drive home this point. When I sit down with patients and they are afraid to adopt chemotherapy because of what they've heard, I just wanted to highlight this because it's something that is important to me. And they're always here. I always tell them things like, there are very few people who undergo cancer treatment and it goes seamlessly, not too much turbulence and all of that go around talking about the kind of treatment that they've had. Most patients keep quiet privately take care of whatever ordeal it is as they go forward. And then, this means that the most times, that the most information you're getting about cancer is coming from patients who have a bad time. We have to be honest with patients and say it's not always a walk in the park, and there are sometimes that things can be distressing. But in the right hand, with
Okay.
your qualified physician taking care of you, who is an expert in that field, you need to get that done. Okay? And you will be fine. Most of the time, people are fine. It's like if you get into a plane today, are we out of time?
We're out of time. Yes, we are out of time.
Or I
We're
can go
out
on.
of
Oh, okay. So what can the government do? Train more oncologists. What can NGOs do? Advocacy, advocacy, advocacy. People need to be educated to know that this is not the horrible thing that they think it is, and that's going to help people. What can the private sector do? Let's spend a little bit more on health for people and get them better as quickly as possible.
Thank
Investment in
you.
health is something that private sector hasn't been doing. Thank you,
Thank
thank
you,
you, thank
thank
you.
you, thank you, thank you, Dr. B. Together we fight, together we win. Please join us again in 2 weeks' time when we will be back on air talking about something different and looking at the Common Cancer Champions Initiative. So follow us on our social media platforms, our handles, as you all know. You can find us on Instagram, Facebook, all of them. I don't know. I don't even know all of them anymore. All of them. YouTube, everything. But this video will be out on YouTube very shortly. So together we fight, together we... Dr. B, thank you, thank you, thank you, thank you, thank you for your time. I hope you get better today. And I look forward to another chat. To our viewers, have a fantastic day. Have a fantastic week ahead of you. And we look forward to seeing you soon. Take care. Thank you. Thank you. Bye. Our message is very clear. Together we'll fight. Together we win.